one has to sit, breathe through the pain so that after some time the pain sort of integrates with the body and doesn't feel like pain anymore, rather than putting your energy into just getting rid of it and then creating resistance.
Gravity is the therapist. A Rolfer, as a Rolfing practitioner, is neither a therapist nor a healer. Their role is to integrate the body so that gravity can flow through it smoothly, with gravity itself being the true healer.
How would you feel if I told you you can get rid of almost any chronic pain in your body? And what would you say if I told you that you wouldn't even need any medicines? In fact, it is the body that will heal itself. But it needs to be guided, and that's exactly who we have with us today. Today's very special guest helps people get rid of deep-seated pain and transforms an individual's life. He's a very gentle soul, a true empath, and an extremely soft-spoken guy. And with this gentle demeanor, he practices the practice of Rolfing. He has comforted and cured numerous ailing bodies. And I know someone very personally who has been cured by him of chronic back pain. Mr. Hiroyoshi Tahata is a true master of Rolfing, which is a remarkable practice that blends science and art to help people find better balance and mobility in their bodies. For over 20 years, he has dedicated his life to this transformative work. But Mr. Tahata is no ordinary Rolfing practitioner. He has developed his own unique approach, which he calls the art of yield. Through this method, he gently guides the body to release deep-seated tensions and restrictions. I have the privilege of welcoming Mr. Hiroshi Tahata on our show today. Welcome to Happy Alien Life.
Thank you for a wonderful introduction for me. It's very honored to be here. So yes, I'm very excited with this project.
Let's begin from the beginning. Where were you born?
I was born in a countryside of Nasu District, Tochigi Prefecture, located 200 kilometers north of Tokyo.
And who did you grow up with?
I grew up with my father and mother until I was 6 years old. A babysitter took care of me during the weekdays. My father was a research officer, National Agricultural Research Institute. And I grew up in a dormitory of the facility's grounds, surrounded by pastures with cattle and sheep grazing nearby.
Can you tell us what is Rolfing? For somebody who has never heard about Rolfing, what exactly is Rolfing?
Okay. Rolfing, officially known as Rolfing Structural Integration, is a holistic system for structural integrating the body established by biochemist Dr. Ida Rolf. Over the course of 15 years, Ida researches and developed methods to create a balanced body that function more efficiently. She discovered that by manipulating the body connective tissue, fascia, through manual intervention, the body's parts could be realigned into their proper positions. This alignment not only enhanced physical functionality, but also facilitated the release from physical and emotional trauma, leading to a harmonious integration of the body, emotions, mind, and spirit. And Rolfing is the art to integrate the body against the gravity field and movement education.
Now, how do you think it is different from a lot of these holistic practices, for example, yoga or the ancient Japanese healing techniques or practices like shiatsu, acupuncture, because they also help, integrate help with structural integration.
Okay, Rolfing is not a medical treatment, so I believe that what's more important than the immediate results after session is how the body continues to change afterward. The goal isn't to eliminate pain, but to educate and guide the body towards coordinated movements that prevent pain. By organizing the body into a continuous, connected state that flows without blockage, it creates a foundation that makes it easier for the body to release the energy of trauma. A Rolfer, as a Rolfing practitioner, is neither a therapist nor a healer. Their role is to integrate the body so that gravity can flow through it smoothly, with gravity itself being the true healer.
When you have a patient, let's say, who has back pain issues, how do you help them get rid of that pain? Can you take us through a step-by-step process when they come to your clinic? Do you actually release the pain through your hands like a chiropractor, or you make them meditate to begin with? How do you actually do it?
First, I usually, if there's enough support for the client, so I always check the support system. For example, joint coordination and such as ankle and knee joint, all the way through the hip joint. So I always check the basic support. Sole of the foot needs to the suitable curvature of the arch of the foot. So I will check, and also.
How do you check it? How do you do the checkup?
So usually I often see the clients walk, observe the clients walking, and sometimes ask the client to bend the knees, like a simple movement. So then a kind of body analysis, much information from the walking.
And then what do you do after the checkup?
Checkup, and then I sometimes touch on the sole of the foot, and then sometimes movement education to more natural movement of the joint. And also I retrieve the resonance of each joint. So then, which cause more continuity all the way through the joints.
Right.
But before touch, I think it's important to see the client from the particular point. So if there is I find a suitable place to see the client. So the client system would feel secure and safety, and then client system will be ready to a change or a transformation. So
So when you say that you find a secure place,
mhm.
what do you mean by a secure place, and how do you find it?
So
Let's say
it's a
you're in your room right now where you are. How would
yes.
you find a secure place here? How would you decide what a secure place is?
So first I find suitable to stay in my body and find another possible places, a few possible places, and then I would ask the client, what about this positioning? So then the place where the client feels comfortable, also I feel more settled in that place. So it is more mutual relationship
And this is obviously without touching, right?
without
So
touching,
you
right?
stand in one area of your room, for instance,
Right,
and the
right.
client is perhaps lying on that bed, right?
Yes, the client
And
lying on the massage table.
and how do you just do you make any hand movements? Do you have any instrument with you to
No,
connect with
just standing
just standing and breathing as well? Do you
and more
also do
focus on
any
my interoception, internal
your
sensation.
internal sensation? So, do you think you try to connect with your chakras? Have you heard about those energy centers like the solar plexus chakra or back? So maybe yeah,
No, not about the chakra system. I focus more gravity center
gravity
in my
center.
own centering point in the true pelvis. When I stand at one point, I feel comfortable, but I also feel the centering point is up. So, which means it's not suitable to stay there. So I move to another place, and then the first standing position should be where I feel settled in and the centering point is lower in the true pelvis. So, and also no resistance with each other. Client also feels settled into the massage table and I also feel settling.
And how long does it take you to reach this, to connect with the gravity and reach a place where you feel comfortable and the client also feels comfortable? How long does it take for both you and the client?
Yeah, usually after finding the suitable position, I stayed several minutes. So then the client system will proceed some reaction spontaneously. Before that, I need to wait.
And how do you proceed from there? So you found your place, your client has found the place, you both feel comfortable in your respective positions, and then what
Right?
happens after that?
After that, usually the client's system begins to have some process. Sometimes the client system would some discharge some energy, and sometimes the client's body wants to some movement. The body wants to complete some uncompleted reaction.
And that takes about how many minutes?
Depends on the person. A very high responding client proceed proceed the process spontaneously, and in such a case, it's not necessary to intervene with touch. Sometimes I just see the client.
Okay, okay. And a typical session of Rolfing takes about how long? One session?
In typical Rolfing session, spend 1 hour.
Rolfing is not a Japanese practice, right?
Right?
Yeah, it came from America, right? Now, as a Japanese person who's practicing, who's a Rolfer, how
Right.
do you integrate Japanese sensibilities and cultural elements into the Rolfing practice? I mean, for example, there are many Japanese martial arts like judo, and they are renowned for their sophisticated understanding of body mechanics and alignment. Now, do you think while you are practicing Rolfing, such ancient and sophisticated Japanese martial arts and cultural elements help you with your practice?
I'm using the concept of ma, so which means space and time, or emptiness, and so I utilize ma for conditioning the field of transformation. So, but the Rolfing concept is a very unique.
Can you tell us a little bit about the concept of ma?
Yeah, ma is already in our lives in many ways. Just look for it, where it is implicit or explicit. In Japanese culture, we see it in the practice of martial arts or in flower arrangement. Our sense of movement in space, our sense of aesthetics, and many other domains of life, governed and influenced by our perception, our kinesphere, and our interaction with others and our environment.
Now, when you talk about aesthetics, Japanese culture has a very minimalistic aesthetic sense. How do you implement that in, your Rolfing techniques, or your studio, for example, where you treat your patients?
So I interested in simplicity. So in basic Rolfing, the Rolfer usually use myofascial release technique with using many touches on the client. It's based on the hands-on technique. But I'm more interested in minimize the intervention, because there's a word of less is more. So it's coming from the Western world, but to minimize intervention is to retrieve the self-regulation system and stimulate the inherent intelligence of the body. So less intervention stimulate the whole system. So I'm more focused on the less intervention. So such as just seeing from the first position to stay in the way of ma.
You must have clients, for example, who come to you for injuries and back pain. What about clients who have PTSD? Do you have clients who come for to cure trauma or something that they are struggling with mentally, which has not yet manifested in the physical form?
So sometimes I use the technique of somatic experiencing, which is developed by Rolf and psychologist Peter Levine. So sometimes it's useful for discharge the traumatic energy. So, but in the Rolfing practice, more focus on the integration. So rather than release something or discharge something, so it's like the computer has some trouble with bug. So engineer wants to find the bug and remove it and remove something. But the integration concept is update the OS system. Upgrade the whole OS system is like a concept of integration, I think.
That's so interesting. Focusing on integration instead of release. Now, don't you think that that sounds like the Japanese concept of kintsugi, where you broken
Kintsugi, yes.
articles are not thrown away, but it's integrated with gold and different metals like that.
Yeah, once fragmented parts of the ceramics, in Western idea, that broken one should be discarded or change something. But in the beauty of the Japanese culture, to reconnect each part, that seems to be very more sophisticated and way to reconnect it, the reintegration into the whole system.
So are you saying
it's like looks more transformation into the different shape, different feature of the works.
more inward looking? It's more inward looking. So are you saying one has to sit, breathe through the pain so that after some time the pain sort of integrates with the body and doesn't feel like pain anymore, rather than putting your energy into just getting rid of it and then creating resistance? Is that right?
I think the traumatic area or restriction needs to be reconnected to the surroundings. So relationship is a more important concept. So in order state, each element or each parts is resonancing with each other, or is has a continuity all the way through. So then the system will more function as a whole.
Right. So the body works collectively is what you're saying.
Right.
Yeah.
The body knows how to proceed, how to regenerate.
It's much more intelligent than what we think it is. and
right,
body.
exactly.
Yeah.
Body knows. Yeah. So Rolfing practitioner or more holistic practitioner give the field to transformation, and then the client's body system will arise, emerge something.
So when you say the field,
Yeah,
the field
is
around me.
some matrix of the around. Yes.
Yeah. And for
Including
instance,
the space.
and if you were here treating me, then your field and my field merge together. Is that right?
So I respect the peripersonal space,
Okay.
each other. Sometimes I feel the boundary of the space, which we call it kinesphere. So I respect the boundary of the space.
It's like the aura of the person, is it?
Probably, yeah, but kinesphere, peripersonal space, we can touch. We can touch some membrane, very thin membrane with touch sensation. It might be different from the energetic field. In some area overlapped.
Okay. And do you also use physical intervention to help integrate the pain?
Yeah, sometimes I use the touch to stimulate the movement, a very micro movement.
When you physically help the client integrate the pain, do you also use any instrument or an apparatus or anything of that sort?
Yeah, sometimes I use the tensegrity model, so which is referred to as suitable tonus.
How does it look like?
This is a tensegrity model.
And how does it work? What is it called? Tensegrity model.
So it expresses the suitable tone of the whole system. So this is composed of tensional materials and the compressed material. So it shows stable and flexible when the impact to this model and absorb the impact and disperse immediately. So when I, as a practitioner, have an image of the of this model of the texture, and also very interestingly, if the person, which is a high responder, very spontaneous movement, continues to release something, and when he or she continues to move, but they need to settle and integrated into the closure. So I ask them to hold this model, and sometimes I observe the client would settle in, and the reaction will goes to the end. It is very helpful. In other cases, when the client feels discomfort after the table work, so I ask them to just have this model and or close to the close to that area with the, with contacting of this model. So then the client sometimes feels less comfort, less discomfort.
Okay. Now, what type of ailments do clients come to you with? Back pain, leg injury? Do pregnant women and children come to you as well?
Yeah. There are three types of the clients. One is they expect some improvement of the chronic pain or body situation, and for the second group, they want to have some experience of personal growth to connect with the body. And in another, in the last group, they just have a curiosity about Rolfing.
And people from all around the world come to you, or is it just Japanese people who come to your clinic?
Most clients are Japanese, but now some US people or European people comes to my office to receive the Rolfing.
And you see, the body type of a Japanese person and an European or an Indian, they are very different. Do you think that affects the way you treat the patient, especially in terms of Rolfing? To find the field.
So in Rolfing, I don't think much effect from the country. Each client has each own pattern. So more depends on the personal level of the structural pattern or functional pattern. It's not about the nations.
Can you share some of your rewarding moments as a Rolfer where your clients actually was so excited that their chronic pain just disappeared or their injury improved drastically and you felt so happy as a Rolfer?
Yeah, I had a young client. So he had a asthma attack in every winter.
Asthma attack?
Asthma, breathing difficulty.
Okay.
He had once a year suffering from the attacks. So his mother took me to my office, and then I gave 10 series of Rolfing. And after the session of the Rolfing, the attack asthma was gone.
Show me.
So this is a boy.
Oh wow! Look at his posture change gradually. And do the symptoms go away immediately, or does it take a long time? Or does it happen that the client goes and tells you, your session didn't impact me at all, but then after 6 months comes back and tells you it really worked?
Mm-hmm. Yeah. So for this boy, after 1 or 2 sessions, he realized no sounds of breathing in sleeping. His mother told me, so more space around the pharynx around. So maybe the more flow of the breathing more easily. So the result will arise rapidly in that case. But in another case, one pharmacist came to me. She had a long-term medication with steroid because she had a severe pain on her whole body. But the steroid didn't work for her, so she stopped take that medicine. And then she came to my office, and I gave 10 seeds of Rolfing. But just after the 10 seeds of Rolfing, she felt nothing of the change about pain. But she noticed after the 6 months, she realized no pain of her body. So during that time, she had not received some medical intervention or some therapeutic intervention. So she realized Rolfing may affect on her. So she reported me that I had a traffic accident in junior high school. So I felt my balance is not, it was not good and disintegrated, I felt. But I know there are some choices of the alternative medical approach, such as acupuncture or shiatsu in Japanese traditional medicine. But I was not interested in those kind of interventions somehow. But in high school, I found a book, which is involved in the Rolfing and other modalities of healing arts. So in my impression, the word of Rolfing is very impressive for me. The book described Rolfing as a very painful intervention, but I cannot imagine such a painful intervention for the intervention people want to receive such a very harmful intervention. So the word of Rolfing is very impressive for me. And when I attended one breathing workshop, one Japanese Rolfer joined that workshop. So I, at that time, I felt it's time to receive the Rolfing. So, and after Rolfing process, so I couldn't such a impact results or some improvement just after the 10 series. But before that, I had a severe low back pain every year. So then I noticed, I realized that severe low back pain was gone after the 10 series of my Rolfing experience. So, which experience is very important for me. So then, after finishing my project of the company, and then I decided to go to US and start to attend the Rolfing training at the Rolf Institute in 1995. If the person had no experience about Rolfing, I recommend receive the 10 series of Rolfing. It's a basic framework of the Rolfing.
I tried to look for Rolfers in India, and I was very surprised that there are no Rolfers in India. What about you? When do you plan to come to India?
Once I visited India, so for the next time.
You did? When was that?
I would love to visit again.
When was that? When did you visit India?
Several years ago. Chiang Mai, I visited some retreat center they provide visceral manipulation and visceral manipulation.
What is that?
Deep massage of the internal organ.
And did that help you?
Very interesting experience.
So it didn't help you?
Yes.
Which year? 1990?
Several years ago, between maybe 2015 or 16 or.
How do you think they are different from Japanese people? How are Indians different from Japanese, and how is the culture different from Japan?
Japan and India.
Yep.
I felt be familiar with your country because this is based on the Hindu and Buddhist are very close to many gods there and many temples. And I felt more familiar with there. I met very nice people and very friendly. It's different from the Western taste.
I think India would like to have you again. We would welcome you. And India is very different now from what it used to be 15 years ago. I mean, the warmth is the same. It would be nice to have you.
Yes, I would love to visit again.
And that brings us to the end of this episode. Thank you so much, Mr. Tahata, for this insightful session, this insightful talk. And thank you so much.
My pleasure.
Thank you.